today's topic, we will discuss the link between trauma and addiction. Trauma and addiction are linked. Many people suffering depression have some underlying trauma that has not been resolved. People who have experienced trauma are 4 times more likely to become an alcoholic, 4 times more likely to develop a sexually transmitted disease, 4 times more likely to inject drugs, 3 times more likely to use antidepressant medication, 3 times more likely to be absent from work, 15 times more likely to commit suicide, 2.5 times more likely to smoke tobacco, 3 times more likely to have serious job problems, and 3 times more likely to experience depression. The upcoming video by Jamie Marich will go in depth in explaining the relationship between trauma and addiction.
My name is Dr. Jamie Marich. I am an expert in both addiction and post-traumatic stress disorder and a lot of other illnesses related to traumatic stress. A little bit about my professional background. I am a licensed professional counselor in the state of Ohio, clinical counselor. I'm also a licensed chemical dependency counselor. I have a PhD in counseling human services. And right now at this moment, what I do professionally is I work in private practice. I see a lot of individuals who've come out of addiction treatment and have traumatic stress issues that have been identified. I've worked the whole range of treatment, inpatient, outpatient, whatnot, but the trauma addiction link has been a bit of my niche specialty. I also travel around the country training about that, the importance of treating trauma and addiction concurrently. And I've written several articles and my first book on issues related to that as well. I mean, I say that because I think holistic recovery is everything. I have encountered so many people in treatment, meaning professionals who have tried to do it like just the cognitive way. Like, okay, let's change your thoughts here. Or let's deal with just the drinking. Or let's deal with just the mental health. And it doesn't work. I mean, it absolutely doesn't work. Clinically, we have to look at the whole picture altogether. That means body, mind, and spirit. That means let's look at all of the factors that have gone into why a person is here, why they're here seeking treatment. And what I tend to see happen more often than not in addiction treatment is that the trauma gets overlooked. For example, it's like you're here just to deal with your addiction. In a lot of trauma treatment, people are like, oh, well, if we clear up the trauma, then the addiction will go away. And that also doesn't do a service to the client. I mean, the bottom line is the client is a total story, a total person. And we as professionals and people who are addressing their needs really need to treat them as such. So I think there's that branch of holism where we have to look at trauma or other mental illness together with addiction. Then there's also this issue of body, mind, spirit as well. Because, for example, too often in a lot of treatment centers, like only the mind is looked at. Like I said, let's look at your negative thoughts. Let's look at your emotional consequences. In a lot of programs, you sometimes have that spiritual component brought in, where it's like, let's look at the mind and the spirit, but then like the body's totally ignored. So, for example, some of the work I do is teaching addicts and people who've been affected by trauma really how to tune into cues that their bodies are giving them, either about trauma triggers, addiction triggers, stress triggers. And so, I mean, to me, holistic recovery is everything. The people who really make it and succeed long term are the people who've been willing to get to the roots of the problems and look at the whole picture. Here's how the brain works. The brain's like a fist. And here we have the rational brain. That's where our fingers are. Now, this is the part that knows better, the part that has willpower, the part that can speak, the part that has wisdom. This part of the brain is unique to primates. We as humans, of course, have the talking component of it. And then you have this inner brain, which is called the limbic brain. And this is where that fight, flight, or freeze response is known to be. When a person especially gets physically attacked, when a person is taken by surprise, or when a person's level of integrity is so insulted it just causes some type of fight, flight, freeze reaction, this part of the brain gets set off. It's like the brain's panic button. And for a lot of people, if there's nothing done to address that trauma, that panic button can really stay stuck. so it becomes ineffective. And the thing about this limbic brain is when it becomes overloaded, the rational brain quite literally goes offline because all the blood flow is centered to addressing the panic and I need to survive, but then your rational decision making goes kaput, goes out the window. The medical field, the psychological professions tend to see trauma as this redheaded stepchild. It's like we know it's there, we know it affects people, but because it tends to be this very scary prospect to treat, a lot of people get freaked out about treating it. My personal opinion, and this is backed up, by several other people more aged than I in the field, is one of the reasons trauma is really not addressed sufficiently is there's no quick pill that you can give somebody to fix what has happened in the brain as a result of a traumatic experience. With things like depression, there's a chance you can give a person a simple antidepressant. It helps some of the brain levels return. With bipolar disorder, there's some things that can be used. With psychotic disorders, there's some things that organically at the level of the brain can be used to help. With PTSD, there are some medications you can do that can help alleviate some symptoms temporarily, but there is nothing medically that can be given to eradicate it or to maintain it. That's where therapy comes in. That's where recovery comes in. That's where hard work comes in, because the brain can be retrained. Absolutely. You can train the brain or retrain the brain to not go into trauma mode, to not go into reactive mode so much. But again, that takes therapy, recovery, daily dedication, a lot of the holistic pieces of recovery we talked about. And sometimes, like I said, medications can help with some of the symptom relief, like with sleep, maybe some nightmares, maybe some of the depression or anxiety, but nothing medically is going to eradicate PTSD outside of hard work. I have seen some improvements, especially throughout the 90s, and getting more awareness out there, more education about treating clinicians, medical people in trauma. But I think a lot of the resistance is still very fear-based. Here's my opinion of statistics. You may be able to use this. We have none that are precise. And a lot of the reason that is because organizations, treatment centers don't often know what to report. And people often underreport what's really going on. A couple of the statistics I know offhand that you might find useful to this is when you're dealing with trauma and addiction happening concurrently. Of those who have diagnosed post-traumatic stress disorder, about 28% have a substance abuse issue, which means it's not full-blown addiction, but it is, some kind of problematic use has begun, maybe some consequences has started, like a DUI. Then in addition to that, another 35% of people with diagnosable PTSD have a full-blown dependence, like addiction. So you add 28, 35 together, and you see the vast majority of people with diagnosable post-traumatic stress disorder have some kind of addiction issue going on. And, we'd have patients ask us all the time, what are my chances when I leave here? And a clinical director I worked for would tell the patients all the time, you all have a 100% chance to recover when you leave here, if you do what's recommended. And I really believe that. When patients ask me for odds or statistics, I'm like, that ball's in your court. Because, we've given you some suggestions here of what those who have recovered, before have done. And here's what you should follow. And even, in my career, there have been some weeks where I wonder, is this working for anybody? It's like there's nobody on your caseload that seems to be getting it. There are other weeks where it seems like just about everybody's getting it. So, again, numbers and statistics I take with a grain of salt in the field. And I like what I heard, that once you know what you are and you get recovery, you've been introduced to recovery, everybody has a 100% chance if they choose to follow the recommendations.
There is help, and there is a way to resolve past traumas in a healthy way. The education and prevention programs at Life Skills Academy can help. Go to lindamcqueen.org. The page will open up to Life Skills Academy. Again, go to lindamcqueen.org. Once you're there, the page will open up to Life Skills Academy. And while you're at that page, please take advantage of our forums, chats, group meetings, webinars, and hangouts. A link will be provided below. A certificate of completion will be issued upon completion of courses taken with Life Skills Academy. Again, a certificate of completion will be issued once our courses are complete. Please leave your comment and subscribe. Remember to like and share. And if any of you can donate to this channel, please do. Go to lindamcqueen.org to make your donation. Thank you.